Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk about another procedure that is very gratifying. Now, we recently did a video on cosmetic crown lengthening. This video talks about covering recession using the pinhole technique. Sometimes with too hard brushing or for genetic reasons, some people consider orthodontics possibly a concern. The gums around the teeth can recede, and when the gum recedes, the bone underneath recedes also. And it's important to stop that gum and bone recession because it may endanger the tooth and also can have a cosmetic effect. Teeth can become sensitive to cold particularly, may be more subject to decay. So this was a recent case that we did, and a young man came in and had really very severe recession, particularly in the lower, some in the upper. You can see it starting here and a little bit over here, but the lower was dramatically affected, and these teeth were starting to get loose because when the gum recedes, the bone recedes. When the bone recedes, the teeth lose support. So if you'll notice, much of this recession is covered. We can't always cover all of the recession, but certainly there's an enormous improvement. The tissue is not only up more, but is also thicker. It's healthier. It's going to be more resistant to recession and bone loss in the future. This is the before that we showed you before, and this is the after, and you can see there's a dramatic difference. This tissue is very, very thin, and it's on the verge of receding further. Now, in this is the afterward. It's several months later, and this tissue is thicker, it's healthier, it's not going to recede, or if it does, it'll do it much more slowly, if at all, than it would have otherwise. It's important to, if you have recession, get it checked out. So ask your dentist about it, or you can see a periodontist. We like to think in terms of this being a lifetime treatment. A lot of it depends on how the patient takes care of it. If the patient brushes too hard or clenches or grinds, I mean, some of the factors that initially cause it, sometimes we see some shrinkage, but generally we think in terms of this being done one time for the most part. In my opinion, it's much less uncomfortable than certain other types of grafting procedures. We can do 1 tooth, 5 teeth, 20 teeth, all the teeth, depending on how many are necessary to be treated. And remember, if your mouth's not healthy, you're not as healthy as you can be. So subscribe to our YouTube channel. Questions, comments, love to hear from you. Have a really, really, really good day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.